I mean, like we have to cover that. So that's
Okay.
just like just
All right.
idiot.
Did you start it?
I think so. I just got excited.
Yeah.
Go.
Let's talk about disc injuries, something we see every single day in our clinic. And there's going to be a wide variety of these things. So we want to talk a little bit about different types of disc injuries, how we assess them, how we treat them, some of the anatomy that Dr. Ulm is going to cover. Now, if you experience one of these things, you may injure a disc injury. Maybe you're picking something heavy up off the floor, maybe even a toddler. It doesn't have to be a crazy heavy thing. It could be just that right time of the day where you bend over and feel that little pop in the back. It could just present itself as just back pain. Sometimes you'll even get some of the things that go down into the leg. But you don't have to have those full leg symptoms for this to be a disc injury. So we want to talk a little bit how these things are going to present. But let's first talk about some of the anatomy.
Yeah, so the disc is the most common structure in the spine that gets injured. And so we treat this, like Dr. Muse said, every single day. We're seeing this cervical spine herniation or disc injuries, thoracic spine, and of course low back. But we want to kind of talk about the anatomy a little bit because it will explain why prolonged sitting will give you that glute pain or that just aggravates the back, or when you stand up, you feel like you have to kind of like stretch out before you can actually move.
Right.
Or why it might get shooting pain down the leg. And the discs are going to be sort of cartilaginous tissue that are designed to kind of absorb shock. So they're really built, I mean, they're engineered beautifully, and they are essentially like a water balloon with a lot of very stiff, strong rubber bands wrapped around it. And what happens is if you squish the water balloon down, it will push that fluid out against those rubber bands, okay? And those rubber bands actually in the actual disc are called annular fibers. And those annular fibers are what get stressed and strained and ultimately fail to produce the various types of disc injuries that we have. So when you bend forward to sort of pick something up, imagine that fluid, instead of being pushed into all parts of the annular fibers, it gets forced all the way backwards, and then that's what stretches those out over time, and then eventually they sort of like overstretch, they strain, they distort, permanently distort, and then that starts giving you the symptoms that Dr. Muse was talking about.
Yeah, and like I mentioned just a moment ago, there's going to be a variety of ways that the physical properties of the disc actually change. On the least severe end, there's something called a disc protrusion. So that's where the rubber bands, those annular fibers Dr. Ulm just talked about, still have their integrity, but now some of the nuclear material, the jelly and the donut, is beginning to kind of stress and push towards us. So a protrusion is going to be a little bit of a outpouching of those rubber bands. The next one is going to be something called an extrusion, or falls under our herniation category, where now some of that jelly in the donut has actually made its way through those rubber bands, and now it's sitting in the canal where the nerve root sits. So that's where, when we begin to have pressure, whether it's mechanical or chemical pressure on that nerve root, you might start to get some of those leg symptoms. One other category of disc injuries is going to be extrusion, where now that part of that nucleus that has come out actually breaks off and is just kind of floating freely in that space. So
you don't want that.
No, you don't want that. The good thing with that is over time the body does what it does, and it will actually kind of resorb that back up into the bloodstream.
Yeah, so we see all three of those. Now there's subcategories of each of those, but we see all three of those all the time. Now, you might have, in the beginning when he talked about the protrusion or a bulge, that's where those rubber bands are kind of stretched out. You might notice that like your back's just a little bit tighter in the morning, or a little bit stiffer, maybe a little bit achier, or if you drive to go see some family members, a couple hour drive, you get out of the car and it's just really, really stiff, or you get fidgety. You don't have to have pain into the legs or even into the glute, but you might. And then as the progress sort of continues, as the process starts to continues, you might now start having a little bit of glute tightness or aching, maybe even down into the hamstring. That's your classic sciatica. And if it keeps going, and then that bulge either physically pushes up against the nerve root, or the nuclear material that he was talking about, actually the stuff that extruded out of the disc, if that sits on the nerve root, that's going to give you a tremendous amount of unrelenting pain. So we have the tools to be able to assess any of these. Just in addition to obviously what you're saying, we have to take you through a very, very detailed orthopedic, neurological, and mechanical evaluation that Dr. Muse is going to talk about.
Yeah, so if you've watched any of our other videos on our YouTube, which hopefully you have, you've probably heard myself and Dr. Ulm talk about something called the McKinsey method. So we use this McKinsey method to assess each patient on an individual basis. No two disc injuries are alike. So every time a new patient walks in with something like this, we have to go through these same steps to figure out specifically for that person what we need to do. And that's going to include a lot of repeated motions in each and every direction to see which ones are going to be provocative to that patient, but then which one, hopefully one, is going to be one that helps reduce the symptoms. So if you're having those leg symptoms, we want to pick a movement that will hopefully pull those up out of the leg and into the back. And then of course we'll use other things like the soft tissue stuff, the adjustment, to make that whole process go better. But the McKinsey method is going to be a major part of not only the assessment, but also the treatment.
Yeah, and we have lots of videos on that. You can link to, or we can put links in here to videos on what is McKinsey, the centralization, which is what he just talked about, where the symptoms come out of the leg, the evaluation. There's a lot of information on that. But broadly speaking, we're going to use McKinsey as our primary evaluation because it's a very, very, very thorough and robust way to evaluate the mechanical integrity of the spine. But we're also going to do like classic orthopedic tests, and of course, if somebody comes in, we have to do a detailed neurological exam, which honestly sometimes is not done at traditional medical providers. I don't know why. Yeah. But these are all very, very important so that we can establish a really, really good clinical picture so that we know not only what's the source of the pain, but also what are some of the functional causes that might have gotten you here in the first place.
Yeah, and that starting point with that assessment is going to allow us to quarterback this situation, because sometimes with these disc injuries, if it's bad enough, or maybe that extrusion is bad enough where we have like chemical or inflammatory things going on around that nerve root, then maybe we will need something like medication. Maybe at some point we may need some imaging, but first and foremost, we need to do a really good exam to figure out if this is going to be something that we can treat conservatively.
Yeah, and even though we're very willing to order an exam, sort of MRI, or maybe like send you to some of the VIP sort of docs that we work with to get, an injection or maybe even surgery. The vast majority of the time between doing, using McKinsey and doing a lot of the rehab that we would be doing, implementing like a lot of core stuff, joint manipulation or mobilization if you're not into the manipulation thing, soft tissue work, and really trying to get you functioning better. The vast majority of disc injuries, almost no matter how bad they are, how much pain you're in, are very, very fixable. And the last thing that we want to say is, one of the primary tenets of what we try to do here, especially in the case of the disc injuries, we want to make sure that you have exercises that you can be doing at home to reduce your own pain and have control over your symptoms. So if you have just general back tightness every time that you get up in the morning and it's been going on for 5 years and you're just sick of it, or you can't sit down for prolonged periods of time, or shooting pain down your leg, then these are definitely things that we see on a consistent basis.
Yeah, so if you want more information on this stuff, check out our playlist on the McKinsey method on the YouTube channel. There's plenty of other videos besides that, but that's a great place for you to start for this kind of injury. If you have any other questions, be sure to call our office, reach us on Instagram,
YouTube, all the things.
Walk in, come say hi, whatever you want to do, but we're here to help you guys, and we're trying to put out more and more information like this to help you guys.
Hopefully the video helped.
Thanks.